Bismillahirrahmanirrahim. Hello, my name is Siti Nuraisya Pratama Bintang. Here I will presentation about my review journal. Okay, the theme is anxiety from the group Psychiatric Nurse. And the title of this journal is Storytelling Therapy and Watching Cartoon Animations on Anxiety. And this is the citation of the journal. And the research purpose of this journal is aims to determine the comparison of the effectiveness of storytelling therapy and watching animated cartoons on the level of anxiety due to hospitalization in preschool age children at the Hospital Rafflesia, Bengkulu City. And the research question of this journal is how is the effectiveness of storytelling therapy and watching animated cartoons compared to the level of anxiety due to hospitalization in preschool age children. Research data in subject of this journal, data independent sample, and the subject is preschool age children. Method of this journal, research design using quantitative and data collecting technique is a quasi-experimental design of two groups before-after or pre-test and post-test group. And the results showed that the treatment using storytelling was more significant in reducing anxiety in preschool age children at Rafflesia Hospital, Bengkulu City. Compared to watching cartoon animation, seen from the value of the t-test result of the independent sample, the mean value of post-test result was 5 between storytelling therapy and watching cartoon animation, namely 2.00 and 8.00. An interesting fact that I have, 1. The morbidity rate of preschool children in Indonesia is 2.1 million or about 8%. In preschool age children feel pain and must be hospitalizations is a punishment for him, and 1/3 of preschool age children experience hospitalization. Number 2, the long-term impact of preschool age children who experience anxiety to the hospitalization is the inhibition of children's growth and development, according to Apriani 2013. Because of this time, the child is in the golden age, the development will be hampered if the child experiences anxiety to the hospitalization, according to Haryadi 2015. Number 3, the result of a study conducted by Rennick in 2002 and in Tricourse et al. 2009 on 120 pediatric patients in the PICU and pediatric surgical wards, where 17.5% of patients saw anxiety and fear of medical action 6 months after being discharged from the hospital, and 14% saw fear of continuing medical action 6 months later. That's all from me for my review journal. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.